Dr. George Kurian, Professor, Department of Nephrology, Amrita Institute of Medical Sciences, Kochi. March 9th, there is a World Kidney Day. The importance of World Kidney Day is to bring in awareness among people about the kidney diseases and mainly its prevention. People with kidney diseases are the most vulnerable in the population. They require a constant and coordinated care, and this care must be for lifelong. World Kidney Day is meant to increase the awareness of people about kidney diseases and its eventual progression to ESRD or end-stage renal disease. And if end-stage renal disease is left untreated, it will lead to eventual mortality. Most important disease states which lead on to chronic kidney disease are diabetes and hypertension. And diabetes is the most common disease which can lead on to chronic kidney disease. India is known as the diabetic capital of the world because the disease burden in India is much more than any other country in the world. So we have a higher number of diabetic patients, and these patients, almost 30 to 40% can develop what is called diabetic nephropathy and chronic kidney disease and end-stage renal disease. So if measures are not taken sufficiently early, the diabetic patients, they can develop what is called diabetic nephropathy. So to prevent or at least to delay the progression of delay the development of diabetic nephropathy, the people should be aware and how to screen for diabetic nephropathy, that they should. At least all patients with the diabetes, they should undergo a urine for microalbuminuria or proteinuria at least once a year in the early part of diabetes, and probably once in every 6 months after 5 years of diabetes. Because the burden is so high, around 30 to 40% of diabetes can lead on to diabetic nephropathy. So the patients who are diagnosed to have diabetes, they should strictly control their blood pressures in the early part of diabetes, so that at least we can delay the onset of diabetic nephropathy. And once diabetic nephropathy is diagnosed, still we can delay the progression by taking appropriate measures like blood pressure control, blood sugar control, and other drugs that can prevent the protein leak, which is the most important factor in delaying the progression. So we need to reduce the protein intake. Then the drugs, there are various drugs which are available. Those drugs, by using them, we can delay the progression of diabetic nephropathy. So another important disease or disease state that can lead on to chronic kidney disease is hypertension. So any patient, it should not be ignored, because 1 out of 10 hypertensive patients, it is have what is called chronic kidney disease or kidney disease. So for all patients, especially below the age of 40, we need to screen them, and we need to do appropriate tests that lead on to the cause of hypertension. Mostly, when we call the patients who are less than 40, they are called young hypertensives. So those patients, they may have a hypertensive state which the cause of hypertension which can be cured. All these hypertensive patients they need to be monitored for proteinuria, because the hypertension could be a cause as well as effect of chronic kidney disease. So then we need to screen them for proteinuria. We need to do their blood test for creatinine for the development of chronic kidney disease. And the chronic kidney disease is a silent killer because they may not have any symptoms or signs in the early phases of chronic kidney disease. So we need, when the patients come for any routine evaluations, we need to check their blood pressures. Then we need to have a urine routine evaluation for looking for proteinuria, hematuria. Then we need to have a blood value that is called a creatinine, which is a measure of kidney function. And if a patient is hypertensive and we have proteinuria, we need to have a ultrasound scan of abdomen. Scan of abdomen that will, so by these simple tests, we will be able to diagnose almost 99% of the kidney diseases. So important factor is to all these vulnerable groups, especially the diabetes, hypertensives, or any long duration systemic diseases. They need to be screened for evidence of chronic kidney disease. So the important factor is prevention is better than cure, because the treatment of chronic kidney disease is financially not viable for, especially not viable for most of the Indians who don't have insurance coverage. So it's important to again stress the factor that prevention is better than cure. Thank you.